Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. The stages of rectal cancer. Rectal cancer is cancer that originates in the tissues of the rectum. This type of cancer is sometimes referred to as colorectal cancer. The colon, rectum, and anal canal are all parts of the digestive system. The rectum is situated between the colon and the anus. Cancer can originate in any of these areas. /r/n/r/n. The place where cancer cells start to form and grow will determine the type of cancer you have. Colon cancer and rectal cancer are both forms of colorectal cancer. Anal cancer is not. /r/n/r/n. Like most cancers, rectal cancer is classified in stages from 0 to 4. The stage indicates the size and type of tumor and the amount of spread, metastasis, that has occurred. /r/n/r/n. Hale Getty Imagesrnrn Rectal cancer typically originates in polyps, growths, within the inner lining of the rectum. Polyps are common in this part of the body and don't always turn into cancer. The polyps most likely to become cancerous are referred to as villous adenomas. /r/n/r/n. The American Joint Committee on Cancer, AJCCTNM system is usually used to stage rectal cancer. This system uses a combination of 3 indicators to determine what stage the cancer is in. /r/n/r/n. Rectal cancer is staged from stage 0 to stage 4 and includes several substages. /r/n/r/n. Stage 0 TNM characteristics. /r/n/r/n. Carcinoma in situ is sometimes referred to as precancer. When rectal cancer is in stage 0, abnormal cells have been found only in the innermost layer, mucosa, of the rectum wall. These cells may have the potential to become malignant, cancerous, but are not yet considered cancer. /r/n/r/n. Stage 1 TNM characteristics. /r/n/r/n. When rectal cancer is in stage 1, cancerous cells have spread out from the mucosa into the surrounding tissue layer, submucosa, or into the muscle layer of the rectum wall. /r/n/r/n. Stage 2 ATNM. /r/n/r/n. Stage 2 rectal cancer is further broken down into symptom groups 2A, 2B, and 2C. In stage 2A, cancerous cells have spread into the outermost rectum wall layer, serosa. At this point in the cancer's progression, there is no spread outside of the rectum wall. /r/n/r/n. Stage 2B TNM. /r/n/r/n. In this stage, cancer cells have spread out of the serosa and into the layer of tissue that lines the outsides of the organs within the abdomen, visceral peritoneum. These organs include the liver, bladder, and spleen. The cancer has not penetrated inside the organs. /r/n/r/n. Stage 2C TNM. /r/n/r/n. In stage 2C, the tumor has spread outside of the rectum and attached or grown into nearby organs or tissues. Cancerous cells have not spread into lymph nodes or distant organs. /r/n/r/n. Stage 3A TNM. /r/n/r/n. or /r/n/r/n. Stage 3 rectal cancer is further broken down into symptom groups 3A, 3B, and 3C. In stage 3A, cancer has continued to spread in one of 2 ways, /r/n/r/n. Stage 3B TNM. /r/n/r/n. or /r/n/r/n. or /r/n/r/n. Stage 3B rectal cancer indicates spread in one of 3 patterns, /r/n/r/n. Stage 3C TNM, /r/n/r/n. or /r/n/r/n. or /r/n/r/n stage 3C rectal cancer indicates spread in one of three patterns, /r/n/r/n stage 4A TNM, /r/n/r/n stage 4 rectal cancer is also referred to as metastatic rectal cancer. Stage 4 is further broken down into symptom groups 4A, 4B, and 4C. /r/n/r/n in stage 4A, rectal cancer has metastasized, spread, to one distant organ or part of the body. Common sites for metastasis include the liver, prostate, lungs, or distant lymph nodes. /r/n/r/n stage 4B TNM, /r/n/r/n in stage 4B, rectal cancer has spread to more than one distant organ or area of the body. /r/n/r/n stage 4C TNM, /r/n/r/n in stage 4C, rectal cancer has spread to the abdominal wall lining, peritoneum. It may also have spread to other distant organs or parts of the body. /r/n/r/n The differences between rectal and colon cancer start with their point of origin. /r/n/r/n The large intestine, large bowel, is comprised of the colon and rectum. Colon cancer can originate in any part of the colon, which is comprised of four sections, /r/n/r/n The rectum, where rectal cancer originates, is located below the sigmoid colon. /r/n/r/n Rectal cancer tumors and colon cancer tumors usually originate from mutations that occur in polyps. /r/n/r/n Because they're both part of the large intestine, the rectum and colon are housed within a wall that contains many layers. For that reason, rectal cancer tumors and colon cancer tumors share many of the same characteristics and symptoms. /r/n/r/n Most of the rectum lacks the protective outer layer, serosa, that surrounds the entire colon. For this reason, rectal cancer tumors may spread more rapidly or aggressively than colon cancer tumors. /r/n/r/n Common metastatic sites for rectal cancer tumors are the liver, brain, lungs, and peritoneum. Colon cancer rarely spreads to the brain but may spread to any of these other sites. /r/n/r/n Both types of tumors are known to metastasize to nearby or faraway lymph nodes. /r/n/r/n The stage and spread of the cancer will influence your prognosis. Even though the stage is important, it is just one indicator. /r/n/r/n Cutting-edge treatments, such as the use of immunotherapy, treatments that use the immune system, and clinical trials, testing new treatments or treatment regimens, have changed the prognosis landscape. Your experience may be very different from the experiences of others who have rectal cancer in the same stage. /r/n/r/n Tumor grade will also affect your prognosis. Well-differentiated tumors contain tissues that resemble normal tissues. These types of tumors tend to grow and spread more slowly than poorly differentiated or undifferentiated cancer cells do. /r/n/r/n Other factors that can impact your prognosis include age, sex, and overall health. /r/n/r/n Rectal cancer is a potentially life-threatening condition that is curable when caught early. Why? /r/n/r/n The 5-year relative survival rates for rectal cancer are /r/n/r/n Keep in mind that survival rates are only estimates. They're based on the experiences of people diagnosed 5 or more years earlier, and they don't take new treatment innovations into account. /r/n/r/n If you or a loved one has been diagnosed with rectal cancer, you will work with a specialist on a treatment plan. The stage of the cancer and other factors, including your personal preferences for treatment, will be taken into account. /r/n/r/n If the cancer is in stage 0 or stage 1, surgical removal of the tumor will be recommended. This procedure is referred to as a polypectomy. If cancerous cells are found along the edges of the tumor, more extensive surgery may be required. /r/n/r/n rectal cancer in later stages requires a different treatment protocol. Chemotherapy, radiation, and surgery are often combined to treat rectal cancer in stages 2, 3, and 4. The extent of the spread and tumor grade will determine which treatments are used and in what order. /r/n/r/n Some treatments for rectal cancer produce short-term or long-term side effects. If you're undergoing chemotherapy or radiation treatment, you may experience short-term nausea, fatigue, and other symptoms. /r/n/r/n Some treatments produce side effects that are challenging and require a learning curve. For example, if you have a surgical ileostomy, you'll have a stoma, an opening for stool to pass through the abdomen and be collected in an appliance, on either a temporary or permanent basis. /r/n/r/n Your cancer team will provide you with tools that can help you adjust and thrive, even if you have a new normal. /r/n/r/n Rectal cancer that returns after treatment is referred to as recurrent rectal cancer. If the cancer returns, it may be localized, or in distant organs or tissues. The location of the cancer will determine your treatment. /r/n/r/n Cancer that returns usually gets the same stage number you received when you were first diagnosed. In some instances, a restaging number may be given, although this is uncommon. /r/n/r/n Rectal cancer originates in the tissues of the rectum. Because the colon and rectum are both parts of the large bowel, cancer of the colon or rectum is sometimes referred to as colorectal cancer. /r/n/r/n Rectal cancer is staged from 0 to 4, with several substages. Cancer stage and other factors, such as tumor grade, will determine your treatment and prognosis. Rectal cancer is curable when caught early. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.